How would I define complex bariatric surgery? Well, I think complex surgery is revisional bariatric surgery, so surgery in patients who've had a previous bariatric operation, or surgery in patients who are more than 50 or 60 BMI or who are more than 30 stone, or bariatric surgery in patients who have a lot of health conditions. During my career, I have performed over 2,500 bariatric operations, which includes more than 250 bariatric revisional procedures. Revisional surgery is any surgery whereby we convert one operation to the other kind. So it can entail conversion of a failed or a non-performing gastric band to a Roux-en-Y gastric bypass, conversion of a band to a mini bypass, conversion of a band to a sleeve, conversion of a sleeve to a bypass, or a bypass revisions. To perform good revisional surgery, you not only need a keen eye for revisional surgery, but you also need to have the right kind of backup facilities to deliver this operation safely. That requires working in a setup which has extended facilities such as enhanced recovery unit, high dependency unit, or even an intensive care unit. Well, in a band to bypass procedure, when you go in, the first thing is taking the tunnel down. We know that most surgeons form a tunnel around the band in order to reduce the risk of slippage. Now, taking the tunnel down is a tricky affair because you can sometimes make holes in the stomach, and you need a lot of experience to be able to do this safely. Once you take the tunnel down, you have to make sure that you return the anatomy back to normal, because it is only then you can make the second plan for the operation. Now, what are the options from this point on? Well, I believe the best option is converting to a bypass. A bypass not only has a better weight loss, but it has a better complication profile as compared to a band to sleeve conversion. There are two main kinds of bypasses: the Roux-en-Y gastric bypass and the one anastomosis bypass. In a Roux-en-Y gastric bypass, or the more classical bypass, we divide the stomach, we divide the bowel, and join the bowel to the stomach and the bowel to each other after that. In the one anastomosis bypass, there is only one cut, so you divide the stomach, but you do not divide the bowel, you just join the bowel to the stomach directly. So, what are the differences? Well, if a patient has reflux despite deflation of the band, a Roux-en-Y gastric bypass is probably the better option. However, in patients who do not have reflux after a band procedure, I think a one anastomosis bypass is better because it will give you better weight loss, better resolution of your medical health issues. There is always an element of unpredictability during the operation. What does that mean? If somebody has had a gastric band, the gastric band could have eroded into the stomach. The gastric band could have migrated into the chest, giving a hiatus hernia or a hiatus hernia of the pouch. So you need a surgeon and a team that are capable of handling these complications to give you the best possible outcomes. At Healthier Weight, we have a very large and functional MDT. The weekly MDT at Healthier Weight is staffed by surgeons, anesthetists, psychologists, and dietitians. But that is not it. More importantly, we have a cardiologist who supports our MDT. Now, why do I think that is important? Healthier Weight do operations for many complex patients, which include patients who are more than 30 stone, patients whose BMI is more than 60, patients who have a lot of cardiac conditions, or other conditions which can increase the risk of surgery. Having a cardiologist in the MDT not only helps us effectively diagnose these patients, but also manage their perioperative risks so that we can get the best outcomes for our patient. What Healthy Weight have now set up is a medical weight management company. So we can not just deliver good quality surgery for you, but also support your surgery medically with medical weight management physicians. Now, what does that mean? Many of our patients have diabetes. All of these patients are now worked up with a diabetologist who would support your care not only preoperatively but also postoperatively after the operation. This ensures that not only your diabetes is well managed at the time of surgery, but when your diabetes starts getting better after the operation, we know which drugs to stop at the right time. I think it would be wrong to say that all surgery done abroad is bad surgery, Because we know for a fact that there are good surgeons in every country and then there are bad surgeons. The problem is, how do we find out who are good surgeons and who are bad surgeons? A simplistic understanding would be that surgeons who are offering very cheap surgery at knockoff prices with a very short waiting list are usually surgeons who do not have a lot of work. I know for a fact that a lot of the very good bariatric surgeons and revisional surgeons have long waiting lists of between 3 and 6 months and would charge a lot for primary or revisional bariatric surgery. During my time as a bariatric surgeon and a revisional bariatric surgeon, I have seen complications of both kinds of operations from patients who've had surgery abroad. I've seen patients who've been promised a balloon, who've come back to UK and noticed they did not have any weight loss. And when we further investigated those patients, we found out that they never had a balloon in the first place. I've operated on patients who've had a sleeve abroad who cannot eat or drink anything. Such patients you sometimes have to even admit to the hospital for a few weeks or months to feed them appropriately so that you can correct their operation. These operations are not to promote weight loss, but actually to correct bad bariatric operations that have been performed. At Healthy Weight, we only concentrate on delivering bariatric surgery or surgery for obesity. We are not a cosmetic provider. We are not a plastic surgery provider. We only specialize in weight loss because we know that we can do that better than anybody else in UK.